the main reasons that I have started this channel is to break all the stereotypes associated with preterm babies and whatever the mothers who give birth to preterm babies. Hello everyone, welcome back to our channel. In today's special episode, we are going to discuss about a condition called preeclampsia. Stay tuned until the end to find out what it is, what are the reasons, and what are the severities of it, and how to get in control of it. So let's begin the interview. As you all know that I have given birth to Olive at 30 weeks. Initially, until 26th week or 27th week, I was feeling all right, and there was nothing different that I felt. My weight was under control, I had no swellings, and I was even working at that point of time, and I was very happy and healthy. But suddenly, I don't know what happened. I think around my 28th week, I guess. Yes. Yeah, suddenly there were some symptoms like severe headache, and I had a lot of swelling. In my feet, especially my feet were swollen very badly, and then I had lack of sleep. I literally didn't sleep I think in the 29th week completely. I was just sitting and sleeping the whole night. I didn't know what was wrong with me, so I just called over my sister, and she said that I need to check my BP, and I had no clue what was going on. So when I went and when I checked my BP, it was 140 at that point of time. Then we immediately rushed to the hospital, and then so on. You can see the whole story later in my pregnancy video. I'll link that in the description box below, and here you'll be seeing in the iCard also. After watching this video, make sure you watch that video also to understand my complete journey of my pregnancy and the delivery of Olive. So in today's video, I want to ask some questions to my sister so that she will be able to help us understand what exactly happens if there is high BP during pregnancy, and how it affects post-pregnancy, and what are the things that we can do to make sure we can control certain things during our pregnancy. Yeah, so let's begin. Okay, so I would like to ask you, are there any symptoms or criteria to identify hypertension early stages of pregnancy?
In many pregnant women, we may not see the signs right away before the rise of BP. In some women, like you had rapid weight gain.
Yes.
You just gained around 10 kgs in 2 weeks or so.
Yes.
And you had swelling. Yes. And headache, lack of sleep. These are all signs of hypertension in pregnancy. But some women, they may not have any symptoms. They may get diagnosed in the regular checkups when they go to the doctor. But when you find these signs, especially the edema,
swelling,
even after taking 12 hours of rest, edema doesn't get down, or you're gaining your weight fast, like more than 2 kgs per month, or more than half kg per week, then you should think about hypertension. You should think about visiting the doctor. So when you go to the doctor, if your BP readings are between more than or equal to 140/90, which are measured 6 hours apart,
okay,
then you'll be diagnosed as gestational hypertension. Gestational hypertension is the hypertension which you get in your pregnancy, that too after 20 weeks of your pregnancy. If your BP is high before 20 weeks of pregnancy, it is called as chronic hypertension.
Okay.
It's already an existing hypertension. Only if you get the BP after 20 weeks, it is considered as hypertension in pregnancy.
Okay. So another major factor that happened to me was, I thought, swellings are natural, as we watch in movies and all. I was just going with the flow.
Yeah.
Okay, fine, swellings are natural. But there is any difference to identify which is a normal one, which is related to hypertension?
Generally in pregnancy, we tend to get swellings depending on the body type. But there are two types of swellings. We call it as physiological and pathological. Physiological is what you get it at the end of the day, like by evening, after you prolonged sitting, prolonged walking, prolonged standing. When you take rest at least for 12 hours, like overnight, then by morning your swellings will get subsided. But in hypertension, the swelling may not decrease, and when you put your finger or your thumb across the ankle, there will be pitting sign. It is called pitting edema.
Yes, I remember doing that. Yeah, you told me over the phone. I did it myself. Yes.
I told you to self-examine because
Yeah.
when you put your thumb and you press against the ankle bone on the medial side, the pit retains the thumb
Yeah.
impression.
Yeah,
Okay,
yeah.
then it's called pitting edema, and that is an early sign for.
How long can we see that impression? 4-5 seconds
Yeah,
or longer?
or 10 seconds, 20 seconds.
Okay, and
Yeah,
get back.
yeah,
I do remember this, and headache was one of the most
yes.
difficult part to overcome. Yes. Okay.
So in pregnancy, people think that it's only just BP. Come on, it's okay. It's just a tablet. But your entire body gets affected in your pregnancy if you get BP because your brain gets affected, your liver, your kidneys. Okay. So your urine output may get decreased.
Okay.
There may be liver necrosis. There may be a hemorrhage in brain.
Oh,
Yes.
so I think maybe the after the severe prolonged headache, maybe the hemorrhage part. Maybe
Yeah.
I was just scared about that because
Yeah.
it was intolerable. Okay, so this hypertension, is it for all the pregnant women, or are there any specific people that we can just identify beforehand that these people may get hypertension during pregnancy?
So the prevalence is low, but at the same time, we cannot say who may get or who may not get. But there is certain high risk group who may get affected by hypertension per se, like very early pregnancy, some teenage pregnancies, or if it is their first pregnancy, or if they have any new paternity, like if they are into a second marriage or something, and
Oh,
yeah, obese people.
oh,
If the BMI is more than 35, they have higher chances of getting hypertension in pregnancy.
does PCOD, thyroid, or any such other medical conditions that we had before affect?
Definitely. Obesity has a tendency of insulin resistance, and they may have PCOD and thyroid, and definitely they are going to affect or they are going to have higher chances of getting hypertension in pregnancy.
Okay, so my next question is how to avoid getting hypertension during pregnancy? Are there any things that we as women can do?
See, all the modern diseases like hypertension, diabetes, PCOD, thyroid, these are all lifestyle diseases.
Yes.
The more you correct your lifestyle, the more you go towards nature, things will be less complicated. You can avoid many complications, and hypertension is one of it. And even with all the healthy lifestyle, one may get preeclampsia, but lifestyle changes will definitely help them because one of the causes for preeclampsia is dietary deficiency or dietary excess, and especially decrease in calcium. Okay, so for preeclampsia patients, we generally put 2 grams per day of calcium. That is required. That will either it will neutralize or it will decrease the severity of preeclampsia and its effects. So calcium is one important thing. Your diet, your exercise, your food, okay, and regular antenatal checkups is required. So there are many tests that can predict your PIH early. I think you remember.
Yes. During my
what was
the
the
very
experience?
first scan that I had, as soon as I came to know that I was pregnant, we went for a scan. And I really thank that ma'am till today because she was the first person who
Dr.
told me
Monica.
that like I would be maybe attacked with like hypertension, preeclampsia. I remember I was quite cool and all, but I don't know, somehow maybe due to the job stress or something, I don't know, I got affected. But yeah.
Stress is one of the important factors for hypertension in pregnancy, but it doesn't mean that only because you're stressed out you're going to attack with BP. That is different and this is different. This is completely a inner pathological thing between your placenta, your fetus and you. So you don't always, be in that guilt game. Okay,
Yeah,
you don't blame yourself or you don't feel guilty for it because
Yeah.
it's a pathogenesis and you can't help it. We are in
Yeah.
a modern world and these are modern diseases. So there are many tests, but actually I think the incidence can be controlled a little, or the severity or the morbidity or the mortality can be reduced if they are detected early, right?
Exactly.
When you detect it early, and if you follow the checkups regularly and you follow the treatment, there are definitely there is a decreased chance in morbidity and mortality, and you getting affected by BP is very less. But you know, the doctor-patient relationship is somewhere it got abrupted. You know, people lost that trust on the doctors, and doctors are in that safety zone protecting their skin. Why do I go? Because there are many basic tests, like when we went to the scan, you were hardly 16 weeks or so, and because I'm a gynecologist, I know little idea about how to predict the PIH, because I know you are in a high risk zone. Okay, your BMI was little higher side, and there was thyroid, there was PCOD, there is insulin resistance inside your body, and you may land up into preeclampsia. So here, then what I asked the doctor was the Doppler of the uterine artery, and there was high resistance flow in the uterine artery.
I remember.
And then that was a predictor at 16 weeks, and I was like mentally prepared. So this is how we are going to diagnose, but that takes that extra effort, that extra money. But when doctor writes you, even Teena was like quite
I was like, what?
quite normal, cool and chill and all. And when we were discussing about preeclampsia, me and the radiologist, Teena was like, what?
I was like, I'm so cool. But it all changed within a wink of an eye.
Yes. So the awareness is important. At the same time, you trusting your doctor. Okay, this test may give something. A good result. If there is a good result, everybody is happy. But if there is a warning sign, both will get alert. And so this is sometimes it's it disheartens me. So there are certain tests like this. Okay, the uterine Doppler at 16 weeks, and there is called a rollover test. This is a free test actually. You can perform it at your home also. Like when you lie on the side, on your left side, you measure your BP. Okay, and you just lie flat on your back, and then you measure the BP. If the difference is more than 20, okay, if the BP rises more than 20, suppose say if it was 120 when you're on the side, and it is 140 when you lying flat, then it is an indicator. Like
this may occur at any point of pregnancy?
No, it's between 28 to 32 weeks, this rollover test. And the
28.
uterine artery one is at 16 weeks.
As early as 16 and as late as 28.
So 16 weeks you can see a high resistance flow in your uterine artery. At 24 weeks also you can predict PIH, that is the diastolic notch. That is also a radiological predictor, like you get it in your ultrasound. But this also takes certain extra effort and extra money. So doctors why do I make my patient,
And few of the patients, coming from a patient point of view, when the doctor says something like, you're gonna have hypertension or something, not everybody will receive it in the same level.
The anxiety,
that panic state and the stress from the family, everything will be so much high.
That's why in this modern era, this awareness is required.
That's true.
So that whatever we should be ready for anything. Did we think of corona?
No.
So we should be ready, because after all it's a body. It tells you something and you need to accept it, and you should be ready to do the best what your body needs. That is more important than you getting anxious. Why did my doctor say like that? You, rather than you going into anxiety, turn that energy into what you can do best for your body. That is more important, and that will make your doctor's work so easy, and you'll get more productive treatment.
And from the patient's point of view, it also gives us a long-term vision. I can personally say that, because I was also a health psychologist before, so I was like, okay, fine, when this is the situation, so this is a reality and we need to accept it. It can't be like, oh no, I'm not going to get surgery done now, I'm going to wait as long as possible. So certain things, even I think the patients have to be ready in accepting the diagnosis and the prognosis, whatever the treatment that is given from the doctors.
You should be strong, you should be positive.
And accept the reality. That is what is my suggestion.
Because no doctor is your enemy. End of the day, they
Yes.
wanted to do what they have learned.
Yes.
And medicine is a very vast subject, and
Yeah.
everything can't be put in some words in the limited time what you spend with your doctor.
Yeah, that's true.
Because sometimes,
Yeah.
and I remember, like, what was your Doppler? Do you remember? After you getting treated with your BP in the hospital, madam has written your
You
scan.
mean the day before our my surgery?
Yes,
The day-
you
yeah,
had
I-
it 28 weeks, and we did a very recent scan was there, but still, madam suggested fetal Doppler.
Yes, yes.
See, it
yes.
happens to me also when I like see 140 to 90 is a BP, that is the cutoff value.
Yes.
But when the BP is more than 160 by 110,
Mm.
or there are other imminent signs like the signs what you had,
Yeah.
headache,
Weight gain, swelling.
Yes. So, as a doctor, I know something will happen to the baby.
Exactly.
Because we were thinking about the uteroplacental unit,
Yes.
fetal-placental unit
Yes.
that may get affected, your livers, your lungs. I think you remember madam writing LFT, RFT.
Yes,
Then
yes.
you called me. Oh my God, so many tests just
I
for
was
BP.
I was like, what's going so many tests?
Why,
It's
madam?
already there. BP is there. Why test again?
Why test again? Why so many tests? Then I was like, oh, okay.
I didn't know. Frankly speaking, I didn't know that I had so,
this
many
is
complications.
that's why I felt people should be aware of how BP affects your liver, your kidney, your everything, your biochemical markers, your hormones.
Yeah.
Okay. So
Very.
those tests
And not only
require
us,
serum uric acid,
I think
serum
the baby
electrolytes.
in the womb also has got affected because I clearly remember the scan
So
that
yeah,
happened.
let me tell my problem. So madam wrote scan for you.
Yeah.
Then I was thinking from my patient point of view, where many patients ask me in return, madam, మొన్ననే scan చేసుకున్నాం.
Yes.
Madam, we did a scan just recently.
Yes. Yes.
Again, we need a scan to do. And I said, yes.
Yes.
And many patients like, this doctor is nuts.
They are just getting money.
Squeezing money.
Yeah, it's not
Then,
like that.
because I was in the place where madam told Preeti we need to get a scan done.
Yes.
Then, because I know, I went right away to the...
Yeah.
Then what happened next? You have to tell.
Oh my God, it was such a big shock. Actually, when I got admitted in the hospital,
You have no symptoms. You are like
Yeah.
active. You're free. You were talking. Like
I was
you're
just
not
walking
drowsy.
all by. I was pretty hyperactive.
Unless we measure your BP, you doesn't even know
Nobody-
what's happening with
yes,
you.
Yes. The only complaint that I had was my headache and my swelling. That was very abnormal. So, coming to the scan the day before, right? Actually, when I got admitted in the hospital, every 1 hour my BP was checked. Repeatedly. I was like, every 1 hour, seriously, these people are squeezing my nerves out of my body. And then, just 2-3 days before my delivery, my doctor was so on point on checking, like you said, the Doppler, like she was checking the heartbeat of Olive, if Olive was fine, because physically I was okay, but we don't know what's going inside. So day and night, you people won't believe, even during the night shifts, I really thank the nurses also. They used to come every hour, literally every hour, and check if the baby is alright. And I had 3 scans just before my surgery. 1 in the hospital, 1 outside, again 1 back in the hospital, and then the next morning I got my surgery done.
So yeah, but that scan was a surprise to me too, because the window period what we got was very less. It
Yeah.
was just 2 weeks. Like
Yes.
you were
Yes.
almost near normal for 2 weeks, and
Yeah.
then I was shocked.
I didn't
Like
expect
what?
that it would
I
shoot
was
up
like,
so
yeah.
fast.
So what happened in your scan?
Thing is that when I went to the hospital, it was 140 BP. Again, the next day 115, next day 160. It was just going on and on and on. I was put
Even
on
with your medication.
I was admitted in the hospital for the monitoring. I was monitored day and night. I was kept on medicines day and night. I had 2 doses, morning and evening, but nothing was under control. It was a terrible thing, and the thing was, I was fine.
Yes.
I was feeling absolutely fine, and the doctors were confused. You were confused. I was happy because you were there.
This is something called refractory hypertension, which doesn't respond to medicines.
So
then-
you mean to say my body didn't respond to any of the medications that were given?
Yes.
This is terrible. terrible. I ate so many.
This is what we discussed at 2 a.m. in the night.
Yeah, I
before your
remember.
scan.
I was just like,
It was 200 by 120.
yeah. Yeah, I'll put that photo also. It was there in the delivery, my pregnancy story and birth of Olive also. That was like in the middle of the night at 2 o'clock. Both the doctors were just roaming here and there, thinking what will happen to me. And my doctor was like, "Don't even get down your bed. Something will happen to you. You'll fall down." I was like, "No, I'll not fall down. I'm feeling fine."
And the risk of eclampsia is more. Eclampsia
like,
is you getting convulsions and getting fits during pregnancy.
She was like,
That is
"Anything can happen to you any minute, Teena. Do not step down the bed." It was
Teena
like,
was like confused.
what? Ma'am, I need to go to the washroom. She was like, "No, you do it here." I was like, "No, I go to the washroom."
So what happened in the scan?
Yeah, so the next morning when she told us to go, like, finally, like, go get a scan done outside, not, oh, and one more thing I want to say from the patient's point of view, your gynecologist has a scan, but that's not enough. You need to go to a radiologist, right?
Also.
Because I know many of my friends and few people in the comments also, they say like, already ma'am has done a scan in her room. Why do we need to go again outside? I want to say that, both are different, right? You people see just
We see the basic screening,
things, yeah.
But doing the Dopplers and all, they take that extra effort. And we
Exactly.
don't have the time in our OPDs.
Yeah, because I was admitted already for 4 days, but when we went to that scan, I came to know about terrible things that happened to me, which I was not even
You're not revealing. I'm asking this question repeatedly. What happened in
Thing
this
is
scan?
that the blood flow from me and Olive has stopped. I don't know since when it was stopped. Though she was checking, maybe she didn't come to know.
It can be diagnosed only on fetal Doppler.
Yes.
With the proper scan.
Yeah.
It has a Doppler.
So patients, when your doctor says to go get scanned, go get a scan. Okay, there was no blood flow and there was a cord around Olive's neck.
Yes.
Yeah, and that was there. And what was there? I remember that the blood flow was
Yeah.
stopped
So
and
this
my
is
mind stopped working. I was like, what? And then we were all like silent. I was mentally prepared. Okay, let's do the surgery. Let's get the baby out. As I know, Olive was fine. That's the reason I say she's a miracle baby, because we don't know since how many days her blood flow was stopped between me and her, but still she survived. So when we came back to the hospital,
When I saw the scan, then I thought, what is happening?
then the doctor said, "Teena, you can go to your room. I'll talk to your sister." I was like, something is there. And I know, I predicted the news will be something. And my sister went and spoke to the doctor. And I went and counseled my father and my mother. I said, okay, don't worry. If something will happen, they'll say, we'll do a surgery and get the baby out. And I was prepared.
Yeah.
And that's what
So
eventually
people
happened.
with diabetes or people with hypertension needs more number of scans than people
Yeah.
who
It
are
was
normal
very
diabetic.
helpful actually.
Because
very helpful.
even before absent diastolic flow, there is a before stage called as decreased diastolic flow. From decreased diastolic flow, it goes into absent diastolic flow and then to a very pathological thing, is reverse diastolic flow.
That happened to one of my friends,
Anita.
Anita, it happened to her. I don't
And
know.
even it was a preterm,
yeah, even her
But-
baby survived. Very good, healthy.
very
now.
cute boy.
Yeah,
So this preterm is not an enigma or not
at all.
A taboo or something. Now it's a new pandemic.
Yeah,
Preterm babies
are everywhere.
are everywhere, and it's a new pandemic. Like corona, it's like it's an active infection going on. But this
I think
is a
it's all
subtle
because
thing.
of, as you said, lifestyle diseases.
Yes,
It's one among them.
Yeah. So this preterms is a new pandemic. You need to accept, and there are going to be many preterm births. It's all because of your lifestyle and number of reasons.
And one more important thing that I would like to say, especially to the husbands of pregnant women and the family, is like, do not hesitate if the doctor gives you any suggestion of surgery or getting the baby out beforehand. Don't be so stubborn, I want normal delivery, I want at this point of time, on that date, or prolong the pregnancy. See, whatever they feel good and right for us, they will do it. All that we need to do.
It all depends on how much trust you
Yeah.
put on the doctor. It's all about your doctor and your relationship.
Yeah.
That is more important.
And I
Building
think the
building a
research that
trust.
we do while we're pregnant also helps. Some knowledge that
being aware
Exactly.
Being ready is different from being anxious and googling everything around there.
No. I don't mean googling.
Okay.
I just mean to say be ready. I was ready. I was ready because I was learning about how to. Literally, I was googling about how to get normal delivery. What are the exercises? I was like 40 weeks, photo shoot, so many things I planned. But that didn't happen. But as I was studying, I was doing my research, as I was preparing mentally for my delivery, long before my delivery, I think that acceptance really helped being positive. Okay, so we'll wind up with one last question. So, for example, if a pregnant woman got diagnosed with preeclampsia, so what are the things that she needs to take care?
Nothing to feel anxious about. Don't panic. Follow regular antenatal checkups. You may need more antenatal checkups than regular patients.
You mean how? 15 days? 10 days?
Yes, 15 days every 2 weeks is mandatory.
Every 2 weeks?
Yeah, every 2 weeks and accordingly. Some
If
may
your
need
doctor
weekly twice. Yeah, accordingly.
I remember my doctor saying come every day. During my 29th week, she literally said come. I went every day because I was little anxious, like, oh, no problem.
Yeah. So follow your doctor and follow good diet. Typical ante what?
Kevin,
Okay.
follow good diet.
Follow good diet. It would be advisable of taking 600 calories per day, but adjust it according to your BMI. Don't starve yourself. Okay. Have good fiber food that have less calories and more satiety.
Okay,
You can get
fiber.
Fiber. So 1600 calories per day is sufficient. Plus or minus is according to your appetite. And then at least 100 grams of protein per day, like 2 grams per kg. High protein diet is advisable. Taking calcium supplementation is very important. You need more higher supplementation than a normal regular woman. It's 2 grams per day. And then you can have some vitamin E, antioxidants. They all help you. You can have it with your food, or you may be supplemented with certain antioxidants that may have little effect, good effect. Okay. So, and then be ready for the pregnancy.
Anytime.
Be ready for the complications. And well monitored BP may not have any morbidity or mortality, but sometimes, as preeclampsia is a very enigmatic disease, it needs more research into the disease as well. So there may be certain complications for the mother and the fetus. Okay, be aware of it, be ready for it, and hopefully no mother should
End up in a bad condition.
in a bad condition.
Yes, I pray.
Okay.
I feel I was really blessed coming out of such a big thing, actually.
Because end of the day, when you get rewards like this, you forget everything. But remember, preeclampsia can recur in 25% of the patients, and it may persist.
You mean the second pregnancy?
Yes, it may persist for more than 6 months in more than 50% of the patients. So your lifestyle management is very important. Not that you have given your birth and you you forget of your BP and all. No.
Oh, really?
Yes. So that family spacing is important. That lifestyle management.
What is the ideal age gap that we need to put between two?
Minimum 2 years and maximum 3 years.
2 to 3 years is
Yeah,
fine.
and provided if you are like below your 30 or 33, but if you are more than 30 years, make sure you wind up your family life before 35 years.
I know that is one of the main reasons for getting
Anxiety.
anxious for getting second baby.
Infertility is again a new pandemic.
Yeah. So, thank you so much for your time and all your valuable information and motivation that you have given to us. And I hope this information is useful. If you do so, if you do think so, please do consider liking our video. Please do consider subscribing and hit the bell icon next to it. Now, this is the result of our what we say.
Turmoil and hard work.
Surprise baby, miracle baby. So no stigmas attached, no stereotypes. And one of the main reasons that I have started this channel is to break all the stereotypes associated with preterm babies and whatever the mothers who give birth to preterm babies. So
Be
no
brave,
problem.
be strong,
Yeah.
be positive,
We are cool. We are
And
strong.
put your effort.
Yes.
Put your effort.
more than anything, I think staying positive and being happy from inside helps a lot. Okay.
Like, share, and subscribe.